Mpox, formerly known as monkeypox, is a viral disease related to smallpox, but generally less severe. The virus was first identified in 1958 during outbreaks in monkey colonies used for research in Copenhagen, Denmark. The first human case was reported in 1970 in the Democratic Republic of the Congo, DRC, where a 9-month-old boy was diagnosed with the virus. Since then, Mpox has primarily been reported in Central and West Africa, where it's considered endemic. Many experts argue that the term monkeypox evokes racist stereotypes and reinforces harmful perceptions of Africa as a disease-ridden continent. This stigmatization can deter people from seeking necessary medical care, which is why the disease's name was changed from monkeypox to Mpox. So, what exactly is Mpox? Mpox belongs to the Orthopoxvirus family, which includes viruses like the variola virus, causing smallpox, cowpox virus, and vaccinia. This virus has existed for decades, primarily in remote parts of Central and West Africa. But recent outbreaks have brought it into the global spotlight. The fatality rate for Mpox has been about 3 to 6%. The illness is usually mild and most people recover within a few weeks. Treatment is mainly aimed at relieving symptoms. Smallpox vaccine, antiviral drugs, and vaccinia immune globulin can be used to treat and control Mpox. According to the WHO, cases usually occur near tropical rainforests, where animals that carry the virus live. Mpox infections have been detected in squirrels, Gambian pouched rats, dormice, and some monkey species. This is why those living or working near wild animals are at higher risk. Mpox, a zoonotic virus, primarily spreads from animals to humans, often through direct contact with the blood, bodily fluids, or skin lesions of an infected animal. It can also be transmitted via bites, scratches, or handling wild animals. While human-to-human transmission is less common, it can occur through close skin-to-skin contact, especially during sexual activity with an infected person. The virus can spread through contact with rashes on non-genital parts of the body, bodily fluids, respiratory droplets, and contaminated items like clothing or bedding. Pregnant women can also pass the virus to their unborn children. Mpox can spread indirectly as well. Touching contaminated surfaces or objects can expose you to the virus, which is why maintaining good personal hygiene and handling items cautiously is crucial. This is particularly important in regions where wild animals are hunted and consumed, as handling wild game poses a significant risk. Unlike some other infections, Mpox doesn't spread easily through casual contact, usually requiring prolonged or close interaction with an infected person. This is why it hasn't spread rapidly in the general population. While the virus can be serious, especially for those with weakened immune systems, it's generally less contagious than the flu or COVID-19. However, since the virus can survive on surfaces for some time, cleaning and disinfecting areas where an infected person has been is essential to prevent further transmission. What are the symptoms of Mpox? Mpox symptoms can be uncomfortable, but early recognition helps you act fast. Mpox tends to follow a pattern, starting with fever, muscle ache, fatigue, headache, swelling of the lymph nodes, and other flu-like symptoms. A few days later, a rash develops, typically beginning on the face and spreading to other body parts. The rash is a key Mpox symptom. It starts as small, flat spots that quickly turn into raised, fluid-filled bumps. These bumps can appear anywhere, but are most common on the face, hands, feet, and inside the mouth. In some cases, the rash may also appear in the genital or anal areas, which can be particularly uncomfortable. As the infection progresses, the fluid in the bumps turns into pus, making them look like larger sores or pustules. These pustules eventually scab over, signaling the body's fight against the virus. However, This is also when the sores are most contagious, so it's important to avoid spreading the virus. The entire process from fever to scabs falling off can last 2 to 4 weeks. During this period, the person remains contagious until all scabs have fallen off and new skin has formed. Limiting close contact with others is crucial to prevent transmission. Mpox can also cause swollen lymph nodes, a key difference from similar illnesses like chickenpox or smallpox. Swelling usually occurs in the neck, armpits, or groin and helps doctors diagnose the illness. Quick identification and response are vital. For example, in the US, a traveler from Nigeria showed these symptoms, and swift action by healthcare professionals not only treated the individual but also prevented a potential outbreak. This highlights the importance of recognizing symptoms and seeking medical attention, especially after travel to areas where Mpox is common.
In severe cases, particularly among those with weakened immune systems, the young or the elderly, complications like secondary infections, respiratory distress, and vision problems can occur. Monitoring symptoms closely and consulting healthcare professionals is crucial if Mpox is suspected. While most people recover without hospitalization, the illness can be more serious for those with pre-existing health conditions. Knowing the full range of symptoms helps you catch it early and protect yourself and others. Who is most vulnerable? Mpox can affect anyone, but some groups are more vulnerable. People living in or traveling to Central and West Africa, where the virus is common, face higher risks, especially those who work closely with animals, like agricultural workers, hunters, or researchers. Location isn't the only factor. Individuals involved in close physical contact, such as healthcare workers, are also at higher risk, particularly if they treat infected patients without proper protective gear like gloves, masks, and protective clothing. People who engage in unprotected sex, especially those with multiple partners, are another high-risk group. Although Mpox isn't usually classified as a sexually transmitted infection, close skin-to-skin contact during sexual activity has played a significant role in its spread. Those with weakened immune systems, such as individuals with HIV/AIDS, those undergoing chemotherapy, or organ transplant recipients, are more susceptible to severe outcomes because their bodies are less able to fight infections. Children and adolescents, particularly in regions where Mpox is endemic, are also more vulnerable. Their developing immune systems might struggle to combat the virus effectively. In previous outbreaks, higher mortality rates were observed in younger populations, highlighting the need for early detection and treatment. Pregnant women are another group at risk. Mpox can be passed from a pregnant woman to her unborn child, potentially leading to severe consequences like congenital infections or stillbirth. Recognizing these high-risk groups is key for targeted prevention strategies. Public health efforts can then focus on protecting these vulnerable populations through vaccination, education, and other preventive measures. Global awareness and preparedness are crucial, as the interconnected world means that Mpox, despite its origins in specific regions, can pose a threat everywhere. How to prevent Mpox? So how can we protect ourselves? The good news is that there are several effective ways to prevent Mpox. First and foremost, it's crucial to avoid close contact with anyone showing symptoms, like that telltale rash we mentioned earlier. This includes not just direct physical contact, but also avoiding sharing personal items like towels, bedding, or clothing with someone who might be infected. Good hygiene practices are also essential. Washing your hands regularly with soap and water is a simple but powerful way to reduce the risk of infection. It's especially important after coming into contact with potentially contaminated surfaces or materials. And yes, as tempting as it might be, try to avoid touching your face, especially your eyes, nose, and mouth, as these are common entry points for the virus. If you're traveling to regions where Mpox is more prevalent, Like Central and West Africa, extra precautions are necessary. Be cautious about interacting with animals, particularly rodents and primates, which are known carriers of the virus. Avoid handling wild animals or their meat, and steer clear of areas where these animals are commonly found. Vaccination is another important tool in preventing Mpox. The smallpox vaccine, which has shown effectiveness against Mpox, due to the similarities between the two viruses, can offer some level of protection. If you fall into a higher risk category, like healthcare workers, laboratory personnel, or those traveling to endemic areas, consider discussing vaccination options with your healthcare provider. Lastly, stay informed. Keep up with the latest updates from public health organizations like the WHO and CDC, especially if there's an outbreak in your area. Knowledge is your first line of defense, and understanding the risks can help you take the necessary steps to protect yourself and others. By combining good hygiene, cautious behavior, and staying informed, you can significantly reduce your chances of contracting Mpox and help prevent its spread in your community. Aftermath and impact. After recovering from Mpox, some individuals might experience lingering health issues, including scarring, chronic pain, vision problems, and secondary infections. Fatigue and psychological effects like anxiety or depression can also occur. Swollen lymph nodes and respiratory issues might persist, particularly in severe cases. Immunocompromised individuals may face prolonged recovery times and increased vulnerability to other infections. Monitoring health and seeking medical advice for any ongoing symptoms is crucial for managing these post-recovery challenges. In 2024, a new strain of Mpox, known as clade Wern, has been causing quite a stir. The outbreak began in Central Africa around September 2023 and has since spread to several countries. The World Health Organization has just declared Mpox a global public health emergency on August 14th, following an outbreak of the viral infection in the Democratic Republic of Congo. As of August 2024, more than 17,000 cases have been reported, with over 500 fatalities, primarily in the Democratic Republic of the Congo, DRC. Before the 2022 outbreak, Mpox was mostly confined to Africa, with only occasional cases reported elsewhere. The last significant outbreak outside Africa was in 2003 in the United States, linked to imported African rodents. It had been nearly 2 decades since Mpox had caused global concern. The virus has not only affected the Congo, but has also been detected in neighboring countries, and even as far as Sweden and Thailand, linked to travel from Africa. The World Health Organization, WHO, has declared this outbreak a public health emergency of international concern, PHEIC, emphasizing the need for a coordinated international response. This new strain, clade Wern, is more severe and has a higher mortality rate compared to the clade Ty2b strain that caused the 2022 outbreak. The current outbreak has a fatality rate of about 3%, which is significantly higher than previous outbreaks.